I've had allergic rhinitis all my life. Ever since I was a little girl, I've suffered with year-round allergies. I usually take over-the-counter antihistamines, decongestants, and nasal sprays all the time, and usually twice a year end up on some antibiotics for a sinus infection. And even with all that therapy, I'm never symptom-free. I usually have headaches on a regular basis, sinus pressure, ear pain, and fevers and cough associated with my problems. I use nasal spray twice a week to help keep my passages open, and other than that, I haven't been on any over-the-counter or prescription medicines, including antibiotics, since the day I had my surgery. The surgery was so simple, and I can't explain how good I feel. I sleep better. I don't have headaches when I wake up in the mornings. I can actually sleep with feather pillows again, which makes my neck feel better. I'm comfortable at rest. I'm comfortable. I breathe better when I'm exercising. I haven't had any headaches. My sense of smell is better. I hear better. I don't cough in the mornings when I wake up. It's just, I just can't tell you. It's huge. Well, I've been a recovery room nurse for about 16 years, and I've taken care of a lot of patients that have had sinus surgery. And I decided years ago that I would never have sinus surgery because I was able to manage my symptoms medically. The patients who have traditional surgery are very sick, even in the recovery room. They have packing up their nose. They're usually throwing up. They always have headaches. Pain is a real problem with them in the recovery room. And I know they miss a lot of work, usually 2 to 4 weeks. And sometimes they don't feel better. Often that surgery has to be repeated. So I had decided I was never going to have sinus surgery. And then Dr. Collette started doing this wonderful balloon procedure, and I saw the patients coming into the recovery room sleeping and comfortable and breathing through their nose at the very beginning. And I thought, wow, that was very interesting. So I approached him and asked him about, would I be a candidate? And he looked at my CAT scan and he said I would be a good candidate for that surgery and that I wouldn't have to miss a lot of work or take a lot of pain medicine. So I thought I was going to be willing to try it based on what I had seen from my own patients. About 6 hours. I went home from, let me see, my surgery was 7:30 in the morning. I was home by noon. I took a nap. I got up and I fixed dinner. I picked the kids up at the bus. We went out for dinner. I had a really good night's sleep, and I went to work the next day. Ask your doctor if they do the balloon. And if they don't, ask them to refer you to somebody who does. If you are a candidate for the balloon, it's the only route you should consider. I would never have considered having traditional sinus surgery.